We're here to share some information about heart care today. So we want to teach you the signs and symptoms of a heart attack. The brochure includes all the signs and symptoms of a heart attack. Sometimes you'll have crushing chest pain. That's a typical symptom that everybody knows, but what we really want you to know and understand is that people a lot of times have shortness of breath. They may have pain in their back or their neck, or sometimes females, diabetics and elderly will have symptoms like pain in their stomach or their back, and they won't have the typical crushing chest pain. So we want you to recognize those symptoms as heart symptoms. Get those symptoms checked out with your doctor to make sure that you're not having a heart attack or heart problems, so that we can prevent you from having a heart attack. If you do recognize that you're having symptoms of a heart attack, we want you to call 911. We don't want you to try to drive yourself to the hospital. So that they can, in the back of the ambulance, they'll be able to send us an EKG, and then we can receive that EKG and activate our Cath lab so that we can be here and ready for you to open up your artery so that you have less damage to your heart. We are also teaching you hands-only CPR. A lot of people are afraid to do mouth-to-mouth. So we want you to understand that if you perform hands-only CPR when someone collapses, that you can actually save their life. So what you do is you run your hands up the rib cage, your fingers up the rib cage to find the breastbone. And once you find the breastbone, you put the palm of your hand above that and lock your hands together, and then you're going to press really hard and fast in the center of the chest. And you want to press about 1 inch to 1.5 inches deep. That will circulate the blood that is sitting in the heart, in the chest, and it can save someone's life. Of course, the first thing you want to do is call 911, and then you're going to start the chest compression so that you can circulate that blood.